Hello my dear friends, I am Dr. Vaishali Bharambe, Professor Anatomy. This is the posterior triangle bound anteriorly by the sternocleidomastoid, posteriorly by the anterior border of trapezius and inferiorly by the middle one-third of clavicle. Today we are discussing a small part of this triangle called the supraclavicular triangle. So come.
You can see that there is a muscle which is dividing this triangle. This muscle is called as the inferior belly of omohyoid muscle, which divides the triangle into an upper occipital triangle and a lower supraclavicular triangle. Can you see that the occipital is a larger triangle? The supraclavicular is a smaller triangle. So now what is our job? Our job is to do each of these triangles, boundaries, floor, contents, right? So let's go to supraclavicular triangle. So let's take a look at this image and tell me the boundaries of the supraclavicular triangle. Anteriorly bound by sternocleidomastoid. Now you know the rest. Inferiorly bound by clavicle. Superiorly bound by the inferior belly of omohyoid. You knew this, okay? Similarly, you know the floor also. This one, which muscle? Scalenus medius. This one, scalenus anterior. This one is the first rib, and this one is the first digitation of serratus anterior. Easy? You already knew these two facts. What is it that you don't know? You don't know the contents, and the contents are very important. This is where the challenge of the class comes in. Rest of it is easy. I'm sure you know that. But this is where the challenge comes in, and this is where you need to have a method of remembering. So now students, concentrate. I'm going to teach you a beautiful method of remembering this. Come on. Okay. Let's take a look at what's happening here. Can you see the cervical vertebrae, first rib and the sternum? And can you see a muscle attached to them? This muscle is scalenus medius muscle, forming what of posterior triangle? Yes, forming the floor of posterior triangle. Now, the rest of the contents are going to come one in front of the other. Okay, lying in front of this is a big plexus. Which plexus is that, students? Yes, it's the brachial plexus and its branches, right? In front of that lies your favorite artery. On the left side, branch of aorta, on the right side, branch of brachiocephalic. Of course, it's the subclavian artery. Okay, in front of it, you can see a muscle crossed by a nerve. The muscle is scalenus anterior and crossing it is a phrenic nerve. In front of that you can see subclavian vein, okay, and above it you can see some lymph nodes crossed by the clavicle. So you saw that structures were appearing one in front of the other, okay. From posterior to anterior they were scalenus medius, brachial plexus, subclavian artery, scalenus anterior, subclavian vein, supraclavicular lymph nodes and clavicle. Yeah, but if I begin to ask you details, would you be able to tell me? Not likely, because there is too much happening, right? So what we're going to do is we're going to group the contents into, so that's your triangle. That's your inferior belly of omohyoid. And this is where your contents are, packed in that tiny little supraclavicular triangle. So we are going to group the contents into nerves, arteries, veins and lymph nodes. Maybe that will help you to remember. Let's see how it works. Try to remember by understanding. There's no point in mugging at all. Okay? So here you can see the same cervical vertebrae, the same first rib again, and the same muscle again, which is the scalenus medius. Till here, all of you know what's going on. Correct? Right. In front of this is your scalenus anterior with a gap. Please go to this small little gap and you can see that there's a clear gap between scalenus medius and scalenus anterior. Through the gap, your brachial plexus and subclavian artery are going to emerge. Okay? So, let's concentrate on that space. Okay? Here is your brachial plexus emerging out. You can see it's giving out a number of branches. Okay, so these are the trunks of the brachial plexus giving rise to branches. Label them dorsal scapular nerve. Please say them as I say them. There's no point in my talking and you just listening. Dorsal scapular nerve, suprascapular nerve, nerve to subclavius, and the beautiful nerve that goes to your serratus anterior? Yes, long thoracic nerve of Bell. Now imagine which of these are actually coming in your supraclavicular triangle. Group them together. So summarize, nerves seen in supraclavicular triangle are as follows. Trunk subbrachial plexus, long thoracic nerve of Bell, nerve to subclavius, and suprascapular nerve. Why not the dorsal scapula? Because it's going higher and will be seen in which triangle? Occipital triangle. Brilliant. So we are done with the nerve content of supraclavicular triangle. Take it now to the scalenus anterior crossbed phrenic nerve and then observe how the subclavian artery enters into the picture. This subclavian artery, as you can see, is divided into three parts by the scalenus anterior. This is your subclavian artery, this is your scalenus anterior, dividing it into part proximal to scalenus anterior, part behind scalenus anterior, part beyond scalenus anterior. First, second and third part. So in my supraclavicular triangle, I can see the third part of subclavian artery. It's branched the dorsal scapular artery and two more branches. Can you see two branches above? These are branches from first part of subclavian. They are superficial cervical artery and suprascapular artery. Now see if you remember. The arteries in the supraclavicular triangle are as follows. 1. Third part of subclavian. 2. Superficial cervical, suprascapular and dorsal scapular arteries. Dorsal scapular being part of branch of third part and the upper two being branches of first part. Okay. Let's take it forward from here. I can see my subclavian. Try to remember what drains into subclavian. External jugular. Good. And what you also see here is the supraclavicular lymph nodes. Okay. So now let's put it all on screen. Veins, subclavian and terminal part of external jugular. Lymph nodes, supraclavicular lymph nodes. Right. So now I think there is some chance of your remembering the contents. The contents of supraclavicular triangle can be grouped into nerves, arteries, veins and lymph nodes. The nerves are trunk subbrachial plexus, the long thoracic nerve, nerve to subclavius, suprascapular nerve. Please observe I have written phrenic nerve here. Sometimes if you really dissect well, you might land up exposing the phrenic nerve which is crossing the scalenus anterior from across. Arteries you already know are third part of subclavian artery, superficial cervical, suprascapular, dorsal scapular arteries. Veins are subclavian and the external jugular draining into it. Lymph nodes are supraclavicular lymph nodes. So, if you try and understand and if you try to group together your answers, you'll be surprised at how fantastically you are able to recall all the contents. Since this is a very commonly asked question, you need to remember these things. Alright, I'm hoping that I have helped you to understand this and memorize it in an easier way. The best way, my dear students, to predict your own future is to create it. By having a good knowledge of the subject, you are actually creating your future. By having a shoddy knowledge of the topic, you are destroying it. What to do is finally completely in your hands. As usual, I enjoyed the class. I hope you did too. Thank you so much. See you across the screen in my next lecture.